I'm here today with Andrew Busuttil, who is a consultant vascular surgeon from Addenbrooke's Hospital in Cambridge, and he is a Freedom to Speak Up listener within the Trust, and he's going to speak to us about that today. So welcome, Andrew. Thank you so much for your time. I really appreciate it.
Thanks, Lizzie. Hi, everyone. Thank you for tuning in to watch this presentation on speaking up and civility or incivility and how it affects our lives day to day. What we'll speak about is initially a bit about the freedom to speak up movement, I call it, or concept, and how we can all contribute to it. The second bit is who am I, why am I doing this? So a bit about me, and then we'll move on to civility saves lives and how small changes that we can make will make a very big difference in how our working lives go, our outcomes for our patients, and all the rest of that. So we'll kick off a bit about the freedom to speak up concept. So this was, like many of you know, but some of us who are new to the NHS may not know this. A while back, there was an inquiry by Sir Robert Francis about increased avoidable deaths in Mid-Staffordshire, and about concerns that staff had with regards to raising their own concerns about unsafe patient care and a bullying culture. So a lot of people chose to try and speak up initially about this, but were met with quite a lot of negative aspects, quite a lot of bullying. Staff chose not to speak up, and the ones that did were severely ostracized. So a lot of them left. That made the problem worse. Relatives eventually started raising concerns and gained momentum via the press. And then this led to the whole Mid-Staffordshire inquiry that we know about. And this is what really gave rise to the concept of freedom to speak up. I often start about what should we be speaking up about, because in my mind, it was always about bullying and bad behavior. But really, there's a lot of things that we need to be raising concerns about if we do come across it. The key thing is whether things are unsafe. Now, whether it's the unsafe patient care that is being delivered, in our opinion, so we need to speak up about that, or the work conditions that we have, whether, rotas are not designed correctly, everything forms part of this. Training and induction is crucially important, especially when we have resident doctors moving from one hospital to another using completely different systems. That raises huge gaps in how we can deliver safe healthcare. Incident reporting is often seen as a punitive thing, but actually reporting incidents is how things are logged and raised, and you may not think much is happening about it, but piles are building up in executive offices about this and trusts up and down the country, and it's actually one way of feeding back what's happening on the ground. You may not get direct feedback from it, so you often feel disillusioned, but it is really important to be able to do that. Fraud is another one which always gets me by surprise. I always forget about fraud, but fraud is actually quite important, because if there is a lot of fraud going around in your organization, then it's quite difficult to be able to deliver a lot of the things we want to. There's lots of resources being wasted. And the other key thing, which is close to my heart, is really a bullying culture. This is something we all need to be speaking up and really stamping out more than anything else. So I'm often asked, but who do I raise concerns to? There's always, whatever bit of the NHS you work in, there's always someone who's managing you. There's always a line manager, so someone who's your direct superior. Now, sometimes you may feel it's a direct superior is the person you want to speak up about, but there's always someone who's one step ahead, one step above them in the chain of command. So there's always someone that you can escalate to. However, there are other aspects. So be it a supervisor, a tutor, raising concerns using the incident reporting systems, or leads for a certain area that may not be directly in charge of what you're doing, and that's often quite helpful. HR is often quite important as well. A lot of the issues colleagues come to speak up about are normally HR matters. So there's a lot of signposting that we do in Freedom to Speak Up to HR, because they're the people that can resolve these matters. So that's another area which colleagues are often referred to. Union and network champions are other aspects as well. We often don't pay too much attention in this, especially as doctors and surgeons. The BMA is there for us and on our side, so it's one thing that we need to keep in mind as well. But there's also a small army of Freedom to Speak Up listeners who are under the auspices of the Guardian. So each trust should have a Guardian, and each trust has a Guardian that reports to an executive on the board. Now, concerns that are raised to the Freedom to Speak Up Guardian are normally logged, and a report, which is anonymous, is presented to the board. So the executives have an idea of what's happening on the ground. And with the amount of scrutiny happening in our NHS, executives are becoming less and less likely to ignore such things. So that's one of the reasons why I always encourage people to use the Freedom to Speak Up service. I put this on because my main area of interest is speaking up for doctors, really, and how nuanced it is, and how often how vulnerable we are. I don't put this up to show you how dangerous it is, just to show you that I understand what's happening. And for those who don't know Chris Day, he is, as far as I'm concerned, a modern day hero. He's an anesthetic trainee, was an anesthetic trainee in London, blew the whistle because he was witness to really unsafe care, really unsafe practices where patients were coming to harm. And the system did what it does best. So they've removed his training number, got him kicked out of the program, and have since been in a very lengthy and costly legal battle with him. So there are huge challenges, and the main challenge is that trainees or resident doctors are not permanent employees, so there's reduced protection. Again, I'm not putting this there to scare you, I'm putting this there to tell you I understand. There's also a lot about the training program, which controls our lives as a trainee, and there are a lot of presumed repercussions for speaking up. And then there are issues that the people you need to speak up to are the people who are in charge of your career progression. Now, this is what a lot of, especially resident doctors, feel. Now, I've now since joined the other side of the fence, so to speak, not that we have fences, but to show that actually a lot of the training program directors, education supervisors, head of schools are actually really keen to avoid any of these negative aspects that trainees come across, and are really there to support their trainees. So things are changing where, people who do these jobs do it for the sake of your well-being. So keep that in mind. Now, a bit about me. I am a vascular surgeon. I've been in post for about 3 years. I've recognized that there is a cultural change happening within surgery, which is also coinciding with a generational change. So the newer, fresh-faced doctors coming through our hospitals and our specialty are really a different generation to us, and I think that's to be celebrated. But the difficulty is that talking two different languages almost, which is where we, need to bridge the gap. Surgery and medicine, I speak about surgery because I'm a surgeon, is having its Me Too moment. It's having it slowly, it's having it glacially as far as I'm concerned, but it's happening. People are raising concerns, people are talking about difficult aspects of being a surgeon in the modern day NHS, and things are starting to change. So I think it's looking good, and we need to hang on to the coattails of this change and really use this to bring about more change in ways we want to see working. We'll talk a bit about incivility. We all know what rudeness is. We all know what bad behavior, bullying, sexual harassment, and physical harm are. And those are bad. There's never any argument about that. And that is very clear cut. You hit someone, you've hit someone, end of story. Incivility is different. Incivility is often mild, it's a bit deviant, it's low intensity, and it's purposely ambiguous so that it causes harm. And it kind of isn't, you leave an interaction feeling quite deflated if someone is being incivil towards you or towards others, actually. And it's quite difficult to weed out and spot, and people often use it because it is quite difficult to weed out and spot. But Civility Saves Lives is a fantastic organization which raises awareness about the effects of incivility. Now, we're talking about low-level incivility. We're not talking about shouting and screaming and throwing toys out of prams. But what they want us to think about is, how we come across when we are being incivil. And this is a very good infographic that they have, where we always feel better because I've showed them, I've put them in their place, but actually you're not really helping. All you're doing is making people feel worse, and then they perform worse. And we'll talk a bit about how that makes a difference. So why bother be civil? Why should we be doing this? Primarily because it matters. And it matters because when we are rude to colleagues, be it either consultant colleagues, anaesthetists, theatre staff, cleaners, whatever it is, people don't perform at their best. And if people are coming to work and it's already a struggle for them to come to work, and they're going to come to work just to be shouted at or, you know, face a whole day of incivility, then they'd probably rather not come to work. And that's when staff sickness increases, and that's where staff turnover increases, and that's when we don't have enough staff to run lists. And that's when the people working with us really don't want to be working with us. And remember, we are now performing at very high levels. We are doing very complex operations. We need the best of everyone. So errors increase, the attention decreases, and there's less helpfulness. So people are not going to go the extra mile if all we're going to do is shout and be rude. So that is, in my opinion, a very selfish way of looking at things, but I will take it. I'm very selfish. I want the brightest and the best to work with me. And the way I achieve that is making sure it's a nice environment for everyone to work in. There's also now more research going on about the effects of rudeness and incivility on how we perform as a team. You all know this. We don't operate in isolation. We need a small army of people to do the fantastic work that we do. And there have been some really good simulation studies where anaesthetists who were blinded to what was going on really performed much worse when the surgeon became quite rude and obnoxious. And we know this because we can kind of figure this out, but now there's a bit more research happening into this area, which gives us a bit more impetus to act. So Civility Saves Lives is an organization which is co-founded by Chris Turner. This is Chris Turner. I'm not going to show you the video primarily because I really can't put things in a way as eloquently as he does. And he gives a very passionate speech about this, and there's lots of information on their website. This is probably the one time any speaker will ask you, get your smartphones out, have a look at this QR code, and then put them back in. This is something you should watch so that you understand the effects of incivility on us, on our teams, on our surroundings, and how they affect our patient outcomes in the end. And that's key here. We all want the best for our patients, so therefore we should all want the best for everyone in the room to help us achieve that. I'm often asked, how do you deal with this? And it is difficult, and it isn't easy, but the reality is that we're used to having difficult conversations, and we're used to doing difficult things, so it shouldn't be something that we shy away from. I think the key thing I always tell people is remain polite and don't engage. I've often, as a more junior trainee, been guilty of this actually, and maybe I put that down to my Mediterranean upbringing, but really that achieves nothing. It just puts you in the same boat as the person who is being impolite and uncivil towards you. I've always asked whoever comes to speak to me about recurring events is to make notes. Keep notes of what's happening right there then, so that you are very clear about what's happened and who was present. Always escalate this, never accept it. Okay, if you think that this is bad behavior and it is, drawing back how you are functioning or how the rest of the team are functioning, nothing good can come of you doing nothing about it. You escalate this to consultant colleagues, to freedom to speak up teams, or you can escalate this to the divisional leads or clinical leads within your unit. The other thing I'm always asked, and again, it tends to be by a different demographic of colleagues, but this is just banter. Can't we not have banter? Like, yes, you can definitely have banter if you're in a pub watching a football match or rugby. When you're in an operating theatre, you're in an environment and things you do affect how other people perform. So whereas you're having a great time with your banter, everyone else isn't. And you may feel like it is, but it isn't. Okay. And that is key to understand that it's okay to have banter, but there are limits, and the limits are fairly low. Okay. And you can ask about, what you did over the weekend, who you went for dinner with and that, but anything more than that starts becoming probably not the right thing to be saying. Don't hit is one of the things which is fairly clear, but things can escalate very quickly. So don't be passive observers. The one thing I say is that more than 99% or 1% is probably 99.99% of us are there to do a good job. We're decent folk, we're hardworking, we want the best for our patients and our colleagues. It's often that 0.1% who are either having a bad day or just like doing things in the wrong way. And this is the key thing where the active bystanders come in, okay? And it's if we ignore this, then that becomes the norm. And this is a recurring theme in what I try and say. One thing I did as a trainee, which was a bit of jest, but actually helped me understand a bit better is in one of the offices we had a little microaggression board. And whoever was a bit microaggressive, a bit incivil, got a point by their name. And that's worked because we kind of diffused the situation very quickly. But then we also kind of realized, actually, maybe, I should change what I'm doing. I was guilty of that myself, and that taught me quite a lot about how what I say affects other people. And it's a good way of adding a bit of humor to it, but actually saying, this isn't good, we shouldn't be doing this, okay? And I asked my son, who is 10 years old, what should we be doing when people are impolite to you? And his thing is be calm and smile. And that often makes things, you can diffuse things nicely there. Solutions. I spend a lot of time thinking about how we can solve this problem. Not that we have a huge problem, but this problem exists. This is a societal problem. This is not something restricted to vascular surgery or surgery. This happens everywhere. We are very much aware of it, and we are doing what we can to try and fix it because we know it matters to how our patients do. And one thing I think about is, should we replicate a system like freedom to speak up, but within vascular surgery, keep it in-house, maybe in a different part of the region, have consultants nominated for different regions to act as a speak up, champion or guardian for that region, to have someone to go to for trainees, colleagues who are having a hard time. Maybe that will help. It doesn't have to be called that. It could be called other things. The School of Surgery, especially as a postgraduate institution, and the societies such as the Vascular Society, I think are key here. They are part of the solution. I think they are the majority of the solution because they hold influence in a number of aspects. They are often very well regarded by all of their peers, and they set the tone for what we should be doing and how we should be behaving. And again, I asked my son, I said, how should we solve this? He thinks, well, it should be taught at school, and maybe it should be taught at school. Maybe we should be teaching our trainees in what is acceptable, what isn't, how to raise concerns, how to have difficult conversations, and what is acceptable and what we should never put up with. And in the beginning of my training, we always had lay members in our panel, and that seemed to have gone away for ARCPs. And I think it's quite important to have someone who's completely not associated with either the Vascular Society, vascular surgery, or training in general, to be available for trainees to speak to, because in many ways they can't influence anything, good or bad, and I think that's quite important. The other aspect is I think we all should have some responsibility here. This isn't something for someone else to do. I think all of us should feel empowered to act and empowered to set the tone for our own unit. And that is the key thing, because the reality is once you are a consultant, you are a consultant and you are in charge. You are a leader. People look up to you. You set the tone. And if you accept bad behavior to happen on your watch, then that becomes acceptable. That's very easy. That becomes something you don't challenge. And then people have to kind of live with that and act wrong. And that's where things continue to escalate. Whereas all it takes is one person to say, actually stop that. That's not the right way to speak to people. I think we should go about things differently. And I think this is, not acceptable. Often, even just querying that makes the other people in the room think, maybe they've got a point. Maybe we shouldn't be doing that. And it kind of sets the tone. So I think the solution lies with all of us. It lies with our leaders, with our societies, but really we have to set the tone. And again, this goes back to the 99% of us who are here to work hard, do well, and make sure that everyone is safe when we're doing so. Why bother? It's not my problem. My unit runs fine. Why should I bother with all of this? Well, actually, it does matter. It matters because what you want is to recruit the brightest and the best, and you want to keep those people working with you. Because if you don't do that, and all you do is bully everyone who comes through, the people who are going to come through are going to think that that's acceptable. If they think that that's acceptable, you're going to be the next victim in the next 10 to 20 years. So, again, the very selfish nature in me wants the brightest and the best to work with me. And I think you do that by being kind to each other. The reputation of your trust, the reputation of your unit, the reputation of your specialty is important. These things matter, okay? And we need to be role models. We need to be role models for our trainees, for our colleagues, for our nursing colleagues, for everyone, okay? Maybe for our other surgical colleagues in different disciplines, to see that actually they're, being nicer to each other and not being rude means that we can have a better time working together. And once more people see that, it becomes the norm, and slowly, slowly things will change. Things are changing. Now, the things that are changing are that the Royal College is kind of waking up to this. They are aware that, there's a lot of bad press about how we are treating each other and how we are treating our trainee doctors. And they've issued a code of conduct, which you can argue is a moot thing because it's obvious, but it wasn't. So it's now there in black and white, so to speak. They've also signed up to the sexual harassment prevention within surgery and within medicine workforce, which is an NHS initiative which really should put a stamp on not having any of this type of behavior. And other aspects are how different countries are doing things differently. The screenshots are there from the Cup of Coffee conversation app. And this is a way which the Royal Australian College of Surgeons is running their Operating with Respect initiative. Now, you can argue, why are they doing this? Maybe they have a bigger problem than us. I don't know. I've never worked there. Or maybe they're aware that this matters. And maybe this is why a lot of our resident doctors are choosing to go to Australia. And this is quite good. This is a useful tool for anyone prepared to have a difficult conversation with colleagues about their behavior. It gives you ways in which you frame the conversation, what to expect, how to push back, how to stay on message and carry out this in a way which isn't really judgmental. It's quite respectful to the colleague, because the reality is it might be a good guy having a bad day. And that's one aspect that we can't ignore. Or it may be someone who's having multiple bad days, or is just someone intent on doing things the wrong way. Any which way, as leaders in whatever field we are, this is an important tool, because we need to be having these difficult conversations simply so that we set the tone of what is and what isn't acceptable. Now, we speak a lot about what we should be doing and a lot about what the ideal is, but the reality might be quite different from what I want it to be, and certainly what a lot of us want it to be. The key thing I tell a lot of our resident doctors when I meet them, whenever they join our trust, is it may be perceived to be quite bad in medicine and surgery, and I'm not saying it's good. I think there's a lot of room for improvement, but this is happening everywhere. It's often much worse in a lot of different industries where freedom to speak up simply doesn't exist, and all you get is a little brown box to put your things in and get out on the same day. So without wanting to excuse anything, I think we are making progress, but there's still a long way to go. So the first thing is glass houses. I'm aware of the impact bullying can have on a unit. I wouldn't say I've witnessed it firsthand, but I've witnessed the after effects of it. So I come at it from a point where I'm not trying to preach anything in any way, shape, or form. All I want to do is try and raise awareness of how we can do better for all of us. Now, in the next few bits of this slide, I mentioned things that are happening across our NHS. This isn't a dig at any of the colleagues. This is definitely not that. In fact, this shows the bravery of some of our colleagues in raising concerns and how they deal with things. But there are some really silly things happening. I still can't get over this, and how very brave colleagues in the West Suffolk Hospital wanted to raise concerns about one of their other colleagues. And then the trust very quickly told them, nope, not having that. So they did that anonymously to the coroner, and then things got moving. And the hospital, in its infinite wisdom, decided that they need to hire fingerprint analysts and handwriting analysts to catch the culprits, which beggars belief why that happened. This is a shout out to the brave colleagues there at the West Suffolk Hospital who put a stop to this, who didn't accept this, and stand their feet down. And finally, the chief executive who led this campaign was moved on to a higher paying role in a different part of the NHS. And that is the problem here. There's no accountability for people who are perpetrating a lot of the bullying, although now they're registered with one of the healthcare professions agencies, so they can be held accountable. But these are the things happening. There's a lot of bullying happening in a lot of hospitals, and we need to be mindful that the way we handle bullying and the way other colleagues handle bullying is very different. We may feel like, oh, I've survived that, I can go away. It may be the straw that breaks the camel's back, and we really need to be very careful about how we support colleagues who are having a hard time. Um, there are other aspects which you know, I don't even know where to begin with this. You see, doctors writing things like this, thinking we should put up with a bit of sexual harassment and a bit of bullying because that's the way we've done. I'd love to see what Dr. Hilton would say if his daughter was being sexually harassed and bullied at work, whether he would accept it and think maybe it's all right. I think this is wholly inappropriate, and I think people who share this view should share Dr. Hilton's assessment, and he's retired and should stay retired as far as I'm concerned. I name and shame because I think this is bad behavior and I think this should not go unseen. My argument to this is back in my day, we put up with a lot. Yes, back in your day, you didn't have penicillin. We have penicillin now. So there's a difference, okay? We use penicillin because we have it. We know this thing works, so we should be doing things better. There's also a lot of other aspects where we're assaulting each other even during surgery, and I can't understand how these things are happening, but they are. Luckily, they are being reported and they're being acted on, and it's good to see that these things are coming to light. Not that it's happening, but they are actually being dealt with. What I'm particularly ashamed of is how we're treating our female colleagues, and I think this has to end. There's no place for this, and I'm really grateful for the brave colleagues who have raised concerns here. This isn't easy to do. This is very difficult. It's very traumatic to relive all of this. But the fact that we have more female colleagues who are speaking up about this means that we are more aware of what's happening. Ideally, this should be zero, but there's a way to go until it is zero. But be aware that these things are absolutely not acceptable. And for any of you listening to this who have sadly gone through this, I apologize on behalf of whoever's done it, but please don't suffer in silence. And we're also seeing that the regulators finally waking up to the fact that we shouldn't be doing things like this. And there was a transplant surgeon suspended simply because of sexual harassment rather than anything else. So he was in a position of power and made a lot of his resident doctors feel very uncomfortable. And things are being taken seriously. This is the reason for the slide, is to show that there are bad things happening. We are moving towards a better place. There is no way we should accept any of this. I like this. And I know it's not nice to end on the world's worst nuclear disaster. However, this is a scene from Chernobyl in the control room a few seconds before the fatal explosion. And if any of you haven't seen the HBO miniseries, I really recommend you do, because it's a fascinating insight into how bad we can be as human beings when we don't listen to each other, where we don't allow people to raise concerns. And there is a cost to not raising concerns and not speaking up. And this is where the power of the bystanders come in. And I'm also aware that we shouldn't end on the world's greatest disaster. However, my son took part in a remake of Matilda for their school play, and something hit home, which was quite interesting. And again, really important that we pay attention to this. One of the lines in one of their title songs is, if you take it on the chin and wear it, nothing will change. And that is the key thing. If we accept bad behavior, then it's just going to carry on. And we have the power and the ability to put a stop to this if we all decide that this is something that we should stop doing. And I would like to leave with this, and I think it's important that we all are aware that egos should be left well outside the room, and we should all work together to get the best outcomes we can for our colleagues and our patients, more importantly. But thank you very much for this.
Brilliant. Thank you so much, Andrew. That's really, really fascinating and so helpful. Can I just, there's so much there that I could ask about and pick up on. I love the fact that you raise the fact that 99% of people want a better work environment and are behaving okay. And I think, yes, you sort of reveal all those awful stories of things that are going on. And I think it's very easy, isn't it, to think that because of that, it just feels hopeless to do anything about it. And I think it's so important to kind of realize that actually there are these sort of things that everybody can do. Because yes, we can't influence the whole management structure of the NHS, or how some managers behave badly when they receive complaints. But everybody can make a difference in their own environment. And I think I love the way that you've highlighted that, because that's kind of intrinsic to what this Rising Tide project's all about. And there's things you mentioned about just actually challenging people openly but gently before it kind of needs to escalate. I feel like, I don't know what you'd say about that. I feel like there's a lot that people just sort of don't say early on that then becomes something bigger.
It's a difficult thing to do and a difficult conversation to have. That's the key thing. And a lot of us think, well, it's not directed at me, so I'm going to leave it alone. But I don't know, have you seen Chris Turner's TED Talk?
No, I haven't.
Oh, you should, because he goes through it again way more eloquently than I
Yes.
can about
Yeah.
the effect incivility and rudeness has on bystanders.
Yes.
Not on just the two of us, it's the whole room.
Yes.
And again, if you have that, then if you accept that, then you're accepting pretty poor standards for everything else. Because you know that if I'm shouting and screaming in our MDT meeting, everyone else is just going to dip. We're not
Yes.
going to get the best of the best. So I think that's the key take-home message for me, is that we all have our part to play here.
Yeah. And even, you mentioned banter, this kind of, where does banter become not banter? And I think, you can think that you've got the relationship with this particular person that you can banter in this way, but there are other people who are listening as well. And, you don't have that relationship with them. It's, as you said, it's just, it's a very kind of low or high bar, let's say, for banter. Nothing, just don't do it. And then you can be that then you're not going to get into trouble.
I challenged I gave this talk to the head of the School of Surgery in Cambridge, for the east of England, and again he was slightly older, a bit more old-fashioned, and thought, it's just a bit of banter. I said,
Yeah.
are you doing an operation or are you watching a football match? He said, so you're doing an operation. Do an operation. That's all. Okay? Keep it light. Do your operation. And then what happened there was something which I think was one of the most fascinating things ever, is that all the female consultants stood up and said, you know what, you talk about banter. This happened to me when I was a trainee. This happened to me. And they just went at him one after the other. So it's not banter. And it's very clear that it's not banter. It's banter to you because you're a professor of so-and-so, but everyone else isn't. So I think the banter is a dangerous argument. I
Yes,
think
and
it's
it's almost like, if you're somebody that sort of thinks, oh, it's just banter, then you're probably the person that most needs to stop doing it, because you have no awareness of what your banter actually is, what the effect that's having on other people.
yeah.
Yeah. And again, I just think it's so important, this, all these lower level interventions, things that you can do, that we can all do, are so important, because you were inspiring trust in speaking up and using those mechanisms. And of course that's so important, but we all know that there will be plenty of cases in which people don't feel confident to do that. And you mentioned that this goes forward from the freedom to speak up guardians as a confidential report. You've got to trust that that really is the case, haven't you? And your example of the fingerprinting and whatever is obviously an extreme, but yeah, if you don't trust the system, everybody knows these stories, and so of course people will be holding back on speaking up. So it's those kind of less formal things, perhaps, that feel less risky, but that can make a difference, that are also very important.
It's also like the low-hanging fruit. I think it's easy. It doesn't take much. It doesn't cost anything. You don't need a course. You don't need anything. You can just do it.
Yes.
And that's the point I try and emphasize when I speak to different units within the hospital about this.
Yeah, and you say you don't need a course. You don't need to be told exactly how to do it, but you're right. What you're doing is important, because you probably, it's helpful to be encouraged to do it, and to
Yeah.
be shown that this is what is normal, or can be normal, or is expected. because
Having
my
said that,
experience is that people's default is just to bury it, keep quiet, say nothing, don't make a fuss, and then things perpetuate. And so they need that encouragement to speak out.
yeah, having said that, I'm doing a course on active bystanders later on today, so maybe you do.
So training is helpful. You know,
Yeah,
just to
of
know
course it
that
is. No, no.
training exists is helpful,
Yeah,
isn't it? Because
yeah,
it makes people realize how importantly or how seriously this issue is taken.
yeah.
So thank you very much for that. If people want to get in touch with you, and because I know that you're willing to support anybody who wants support in this area, can you just tell us where they or how they can do that?
So I think it's important for colleagues to know that the most important thing is speaking to someone often. So again, I have a lot of people approach me with a lot of concerns, and the first thing I tell them is I can't fix the world, and I don't pretend that I can fix the world. And I'm also not going to be, kicking down doors, shouting at people, because that's not what I do. That's if you can't do that, you can't be judge, jury, and executioner.
Well, it
Very
doesn't work.
often it doesn't work. So very often having someone who is willing to listen normally just takes the weight off. Say, oh, I'm not mad. Someone's listening. I've been able to speak to someone. Having someone who's able to listen, who has nothing to do with your day-to-day life, is probably even better. Ideally, it's someone who understands the ins and outs of it. So you may be going to speak to the cleaner about your issues as a consultant surgeon, might not work, and vice versa. We don't understand each other's worlds. And that's why it's important to have, I think, doctors, particularly surgeons, who understand the meanings of certain nuances. And I'm very clear. I'm always available to speak to whoever wants to. People normally contact me via email, and it's my trusty email address, or via the Vascular Society directory. You can get my email address. And then what I do is I set an appointment so that we both have time to sit down, go through whatever it is that you need to raise concerns about or speak about. A lot of what we do is signposting. Again, I will make that very clear. And the other thing I always mention to colleagues who come and speak to me is, number one, I thank them. It's a very brave thing to do, and it's really important. So that bit is not lost on us. You've probably been agonizing about this for a number of weeks before you decided to sit down and punch through that email. And the other aspect is that confidentiality for me is guaranteed. I will be the only person that knows that you've spoken to me. And we always say we have to be particularly careful with confidentiality if we think that person is at risk or in danger, or if there's a significant patient safety issue that needs raising sooner rather than later. And that will be made clear before we start talking. And after that, what I like to do is kind of summarize all of this it sounds formal, but in a type of report, where it's very clear, very factual, as to what's happened. And again, the name never features into it. It's, again, normally me that knows it. And that is helpful, because that is, I use the word loosely, evidence of what's happening. And if 2, 3, 4, 10 people come to speak to me with the same story, writing down the same thing, that becomes harder to ignore and easier for the hospital leadership to deal with. Whereas if it's just one person saying, oh, really don't like that Andrew fella, he annoys me, then that's neither here nor there. I may be annoying, I may be not nice to them, but you can't really do anything about that. So that's why I think it's important for a number of reasons. Number one, you need to feel listened to. Number two, it's important for us to document what's happening so that we can have a better idea as to what's happening. And number three is we need to give the people who can make change the evidence of what's happening on the ground, because without that, then no change can happen.